Hi, in the fourth part of this lecture, we'll talk about cardiovascular disorders and their life-threatening consequences. So we have the most common cardiovascular diseases include hypertension, atherosclerosis, heart attack, heart failure, embolism, stroke, and varicose veins. So risk factors, basically cardiovascular diseases have been the forefront of the health problems in the middle of the 20th century. That is in direct correlation to the rise of the antibiotics and the vaccines at the start of the 20th century, because most diseases from that time that were previously uncurable, such as tuberculosis and some mostly infectious diseases, they have remedies have been found from them in the form of the antibiotics and the vaccines. So that's why by the middle of the 20th century, those diseases have been known to be, for example, actually they are considered already curable and solved. So that left the uncurable diseases, which were the cardiovascular diseases. That is why this around 1980s, 1970s, there was a revolution in terms of people becoming more health conscious because of these cardiovascular diseases, because aside from surgical therapy, which is moderately effective or has very limited success, there is basically no cure for them aside from prevention. But anyway, so we have several risk factors for cardiovascular diseases. We have the genetic risk factors, which are the family history, gender, ethnic background. So, family history of heart attack prior to age 55 indicates a genetic predisposition to heart disease. So, basically, most of these risk factors are correlation analysis. So, environmental risk factors such as smoking, overeating, and a sedentary lifestyle. So, these studies indicate that 40 minutes a day of low-impact exercise reduces the chance of heart disease by 1/3. So, males also is known to suffer cardiovascular diseases more frequently than females, but as of recent studies, there is a narrower gap between them. Now, let's look at each of those cardiovascular diseases. The most common is high blood pressure or hypertension. It's known as the silent killer because it's usually asymptomatic. So, you are only diagnosed when the systolic blood pressure is above 140 mm mercury or the diastolic pressure is above 90 mm mercury. So, high diastolic number indicates a decline in blood vessel elasticity. So, blood pressure can also be a symptom of another underlying diseases or another underlying disease. So, chronic hypertension causes capillary beds to leak blood into the surrounding tissues, or they can entirely break because remember, capillary is a very thin wall, one cell thick. So, the key risk for chronic hypertension is stroke. So, to control hypertension, of course, it's basically lifestyle change. Dietary restriction, moderate exercise, reducing the smoking and drinking, and some medications that lower your blood pressure. So, another cardiovascular disease is the atherosclerosis. It's literally known as hardened vessels. So, it can cause its effects can cause disability or death. So, in atherosclerosis, plaques accumulate in the vessel wall. So, these plaques are fatty acid deposits or usually rich in cholesterol. So, they occlude, or basically they narrow your the lumen, basically the inside of your blood vessel. So, for example, if this is the interior, if you have a plaque here, you have a lower cross-sectional area of your blood vessels. So, the serious complications can arise if the plaque causes clot to form the vessel. So, one of the symptoms or other effects of this occluded blood vessel is, of course, reduced blood flow. So, the tendency is that your heart will have to work harder in order to deliver enough blood to the rest of the body. So, basically, you will have it can be a cause or it can be both a symptom or an effect. So, you have atherosclerosis may lead to actually myocardial infarction if your or even heart enlargement, especially if your heart is overworked. So, anyway, serious complications can arise if the plaque causes clot to form within the vessel. So, you have thrombus, a clot that is attached to the vessel wall. So, thrombus is the less generally the less problematic of the two. Embolism is a loosened clot that floats in the mainstream. It can lodge to a smaller vessel or to completely block the blood flow and cause tissue death beyond that blockage. So another one is aneurysm, which occurs when a vessel wall balloons under pressure. So they form a weak spot that may burst due to increased blood pressure generated by each heartbeat. So burst aneurysms are usually fatal because they tend to develop in large, high-volume arteries in the abdomen or in the brain. So in here, you can see your blood vessel, and then this is your balloon vessel. So embolism or aneurysm in the brain causes stroke. And speaking of stroke, stroke starves the tissue of oxygen and nutrients beyond the blocked or broken artery. So basically in stroke, it's basically in the brain. So you have your blocked artery or a burst artery. And since our brain is the most blood-hungry tissue in the body, basically it needs a consistent supply of oxygen and glucose. So when you cut off that supply, you're basically parts of that tissues of the brain that is cut off from the supply dies. So initial symptoms of stroke: sudden difficulty in speaking, blindness in one eye, numbness and or weakness, usually in one side of the body, because the brain, the region of the brain is basically knock on wood, have died. So stroke can cause aphasia or loss of speech, loss of fine motor control process, or even death, because again it's your brain that's affected. Now we have also heart attack. Heart attack, or technically myocardial infarction, is a death of a portion of the heart muscle due to lack of oxygen. So usually occurs due to a plaque located in the coronary artery, thus occluding blood flow to heart cells. So angina or angina pectoris is the pain resulting from a temporary loss of oxygen to the heart. Basically, you can have a heart attack, a mini heart attack, without even realizing you have a heart attack. And that's actually problematic because the region where affected on the heart can either be damaged, and that results in the overcompensation of the rest of the region of the heart. So basically, you will have possible heart enlargement. Just one of the complications. Anyway, angina. In angina, you have pain resulting from temporary loss of oxygen to the heart. So stable angina occurs upon strenuous activity and can be treated by reducing activity and or quitting the smoking. While unstable angina occurs without apparent stimulus and serves as an early warning of an impending heart attack. So treatment for angina. Angina may be controlled with nitrate drugs, so nitroglycerin and isosorbide. So they help relax the smooth muscle in the walls of the coronary arteries. Blood pressure decreases and blood flows more smoothly past the obstructive plate. So surgical options exist to relieve the angina. So you can have bypass surgery, such as this one. So in bypass, you are basically bypassing. Here, the angina here is what is affected is the coronary circulation. So you are just going to graft another vessel to the beyond the affected region, whereas you have an obstruction here. So, or either balloon angioplasty, placement of a stent. A stent is somewhat like a wiring. Well, depending on the type of stent that you will use, but it's usually a wiring that holds the vessel open. So artificial heart implantation is another way. So this is ballooning. So you are putting a balloon inside, so it helps widen your blood vessel, and then you just remove it after widening it. Now the stent is like this one. So it's inside the vessel, and it holds the vessel in a wider. Basically, it widens the vessel, and it's more or less a permanent fixture on there. So it just fixes the vessel in such a way that it's usually open. So this is a stent. And then we also have congestive heart failure. Congestive heart failure is due to a weak heart. So with age, heart may weaken and fail to push enough blood through the circulatory system. So a weakened left ventricle fails to move the blood. So remember, the left ventricle is the one that pushes the blood from your heart to the rest of your body. So allowing the fluid to back up and leak into the lungs. So if you have a weakened left ventricle, so it can back up to the lungs. So it can cause pulmonary edema. So more common now, congestive heart failure is more common now that more people are living deep into old age. So symptoms of congestive heart failure include fatigue, difficulty in breathing, tachycardia or the rapid heart rate, and death due to fluid buildup in the lungs. And then we have the varicose veins. Varicose veins are distensions of venous walls near the valves. These are actually visible usually in the legs, in the lower legs. So they are angry violet streaks of blood vessels there. So if the walls of the veins are weak, the vessel will expand. So spider veins involve the venules. So they are, from its name, they look like spider veins, spider web vein. Okay, surface venules fill with blood, but they do not empty. So that those are the diseases of the cardiovascular, the heart basically, and the blood vessels. Next, we will discuss the last organ. It's because this is basically an organ of the cardiovascular system, which is the blood.